Governor Greg Abbott is joining us live right off the top at 6 o'clock. Governor, hopefully you just heard me talk about Keller ISD, one of our big local districts, and what they're looking at and trying to decide. If we rewind, Attorney General Ken Paxton, as you well know, released last week this legal opinion, putting basically the responsibility of how and when to open the schools back on the local districts and less on the health professionals. It seemed to, and I will say has by now definitely caused confusion for some, frustration for others. What do districts and parents need to know as we head into these final couple of weeks before school starts for the majority of us in Texas?
So know this, and that is what General Paxton wrote about was just an explanation of what the TEA, Texas Education Agency, had previously articulated, as well as what was articulated by the governor, lieutenant governor, the speaker, as well as the chairman of both the House and Senate Public Education Committees. We've been consistent in exactly what we've said all along. First is to put the health and safety of students, teachers, and parents first, and then second, to ensure there is flexibility in the education system. What all that means is this: whether it be Keller or any other ISD, it is the independent school district that has the authority under state law to make these decisions about, first, when they want to open up, then second, how they want to open up. They can open up in August, they can open up in September, they can open up whenever they want to, and then when they open up, they can open up providing in-classroom learning, they can open up with distance, remote-based learning, or they can provide a blend of the two. The reason why we give it to the local school districts, in addition to it being the state law, is because they know best about what the unique circumstances and needs are in that particular district, knowing full well that what exists in Keller is going to be something completely different than what is needed in Kingsville, Texas.
Right. Let me ask you this, Governor, and I'm not one, honestly, to play hypotheticals, but if you had a child or a grandchild yourself in the Dallas or the Fort Worth school district, let's say, how would you want them to start the school year personally? Online, in person? What would be your choice?
I would want to know what the operation is for that particular school or school district. I do have a child. She is now finished with school, but I was very active with her during her school years, and I got to know exactly what was going on in that school setting before the school opened up. My daughter went to school during the H1N1 pandemic, and we allowed her to go to school during that time period without worry and without fear, understanding that the protocols used at that school were safe for the students at that time. I would want to see to make sure that the schools are following these safe protocols that have been articulated by the TEA, but also knowing that these schools do have a level of flexibility to make sure that if it turns out that there is anybody on the school campus who tests positive for COVID-19, they do have the option to shut the school down, to sanitize it, to provide remote learning until such time as it is safe for students to return.
Governor, we were reminded today how randomly deadly this virus can be. And when I say that, I'm talking about Rockwall police officer Tracy Gaines. He died earlier today. He was diagnosed COVID, I think it was about a month ago, had been in the ICU. Memorial for Officer Gaines has started outside the Wilkerson Sanders Memorial Stadium in Rockwall. But I'm curious, are you concerned that as we see cases like that, and that's one of so many, obviously, are you afraid that people might begin to let their guard down in any way as we continue to move forward?
Doug, this is very important. The words you chose were very important, and that is letting your guard down. Let's go back in time to May. Texas opened up in early May, and then when we came around to Memorial Day, there was a feeling, I think, among so many Texans they could let their guard down because the spread of COVID-19 was not that rampant at that particular time. People partied during Memorial Day weekend. There were graduation parties. There were other different types of events where people thought they did not have to be as vigilant in protecting themselves from COVID-19. My point is this, and that is until we have therapeutic treatments, drugs that will come before vaccines, until we have those therapeutic treatments, we do need to have people to remain vigilant, knowing that COVID has not left the state of Texas. It is still here. It still transmits very rapidly, and it can infect anybody, and it can claim anybody's life. And this is just yet another reminder that we must not let our guard down, because if we do so, we can lose somebody's life.
And that takes me to the number of cases of the virus. They're trending down as we have watched daily. Dallas and Tarrant counties overall, Dallas County reporting its lowest one-day total, 382 cases. That's since June 16th. What are you seeing from the state level regarding the numbers? Would you define where we are now as a plateau? Where are we?
So in most regions of the state and for the state as a whole, we've not reached a plateau. We are actually on the decline. We've gone from a positivity rate of more than 17% down to a positivity rate of 12%. We've had declines in hospitalizations, declines in the number of people testing positive. We've had the longest decline in the number of active COVID cases since the beginning of the COVID outbreak. So numbers are going in the right direction. However, all of these number improvements are from very high levels. But I have to go back, Doug, to what I just talked about. If people take any comfort from the fact that the numbers are looking better and let their guard down, those numbers are going to go right back up. The reason why the numbers are improving is not because COVID has suddenly left the state of Texas. It's because over the past month, people in Dallas, people in Fort Worth, people across Texas have done a better job of wearing face coverings, maintaining safe distance practices, using the right hygiene, and in fact, staying home if at all possible. They've been vigilant over the past month, and that's exactly why the numbers have gone down. We need Texans to continue those safe practices if we want to continue to see the numbers go down.
And Governor, we're just about out of time, so a simple yes or no if you could. Do you think the mask order is here for the rest of 2020? Should we expect that?
Not for the rest of 2020. I think that it can be eliminated before then. People need to follow the best rules, but I am anticipating therapeutic drugs coming maybe as soon as next month that should help out.
Okay, Governor Greg Abbott, we appreciate your time as always. Thank you very much, sir.